Do you love waking up early in the morning, struggling to figure out what to do with your hair? We've all had our share of bad hair days. Are you ready for a change? Lock it and love it with Lock and Love Salon, conveniently located at 8117 Liberty Road, Windsor Mills, Maryland. Start your lock journey today. Lock and Love's professional services and artistic designs will keep you blazing in the hottest trends while maintaining and protecting your hair. Honey, Lock and Love is an experience. Once you try Lock and Love Salon, you won't try anyone else. Lock and Love offers starter and maintenance locks, fox locks, detox, shampooing and conditioning, lock treatment, lock extension, coloring, and much more. Sorry, but Lock and Love doesn't accept walk-ins. What are you waiting for? Call 410-970-3791 to set up your appointment today. Lock and Love is on Facebook, so remember to like, follow, and share. Do you love waking up early in the morning, Struggling to figure out what to do with your hair? We've all had our share of bad hair days. Are you ready for a change? Lock it and love it with Lock and Love Salon, conveniently located at 8117 Liberty Road, Windsor Mills, Maryland. Start your lock journey today. Lock and Love's professional services and artistic designs will keep you blazing in the hottest trends while maintaining and protecting your hair. Honey, Lock and Love is an experience. Once you try Lock and Love Salon, you won't try anyone else. Lock and Love offers starter and maintenance locks, fox locks, detox, shampooing and conditioning, lock treatment, lock extension, coloring, and much more. Sorry, but Lock and Love doesn't accept walk-ins. What are you waiting for? Call 410-970-3791 to set up your appointment today. Lock and Love is on Facebook, so remember to like, follow, and share.
Hello, hello, hello. Sorry about the interruptions, guys. Let me start from the beginning. Okay, the opening introduction is good evening and welcome to the Blue Scrub Club Show, a platform where healthcare voices are heard, real conversations are happening, and our communities are educated and empowered. I'm your host, Dr. Charlene Harrod, a woman better known as the nurseologist, a nurse, an advocate, and the founder of the Blue Scrub Club Show. Tonight's conversation is one that many experience, but only few discuss, and it is about mental health. Okay. We will be talking about these points today. We will talk about the different stages of depression. We'll talk about stages of grief. And most importantly, where to get help. That is so important. As healthcare professionals, caregivers, and community leaders, we are often carrying the weight of others while silently managing our own struggles. Tonight, we are creating space for honesty, healing, and support because mental health is not an option, it is essential. So, our first segment, we're going to talk about what is mental health. Okay, mental health refers to a person's emotion, psychological, and social well being. It affects how we think, how we feel, act, how we handle stress, and other related issues. Our talking points would be mental health that impact our daily functions, how it is important to get physical health, do some type of activity through the day so that you can build up your mental health strength. The other thing is stigma. Stigma really plays a big role and it prevent people from seeking help. But hopefully after this show, you'll be able to understand mental health and where to get help when it is needed. Healthcare workers are at high risk due to the stress and burnout from their jobs. So, with that being said, let's just jump right on in. How mental health impacts our daily function. Mental health plays a critical role in how we function every single day. It shapes how we think, how we feel, and how we respond to life challenges. When we talk about daily functioning, we refer to a person's ability to carry out their normal responsibilities, such as going to work, talking, caring for their families, maintaining relationships, making decisions, and even contemplating simple tasks like out of bed, getting out of the bed, eating, responding to messages, just in general. When someone is mentally well, they are generally able to cope with stress. They stay productive and engage in meaningful conversations with others. However, When mental health is compromised, even the smallest task can feel overwhelming. For example, a person experiencing anxiety may struggle with concentrating or making decisions. Someone dealing with depression might feel fatigued, unmotivated, or disconnected from activities altogether and just don't want to enjoy anything. So, this is when mental health comes in, and we talk about emotion regulation. It's something about being able to manage your emotions in different situations. A person with a stable mental health may be able to handle disappointment or frustration or even conflict in a balanced way. In contrast to that, someone struggling may experience heightened emotional responses such as irritability, anger, sadness, and maybe even withdrawing from people. Because we have to be very careful when we are talking to people or trying to figure out what they're experiencing if they are experiencing a mental health crisis. Mental health impacts our relationships different, and people need to recognize that. Not everybody is able to separate what's going on and be able to articulate when they're having a problem and when they're not having a problem. So, what we have to do is we have to be very careful when we're talking to people, especially once we know that they are having a mental health crisis. It influences how we communicate, how we interpret other actions, how we build trust, because as we know, poor mental health can lead to isolation, misunderstanding, and difficult maintaining a healthy connection with others. So it's very important that we learn how to identify when someone is having a mental health crisis and try to direct them in the right way. In healthcare settings, this becomes even more important. Nurses, caregivers, and providers are expected to make critical decisions, providing compassionate care, and remain focused for long periods of time, especially when healthcare providers now are working 12 hours a day instead of 8 hours a day. And in some cases, they're working 16 hours a day. When mental health is affected, it can influence attention to detail, response time, and overall job performance. It's very important if you're at work and you're having a mental health crisis, if you are able to excuse yourself, maybe go into the break room or maybe go into the bathroom and just sit down and take a deep breath. What I've noticed in some situations is when people learn to do deep breath exercises, it does really help you be able to focus more. So that is one of the things I want to help you guys with. Now, when taking a deep breath, you put one hand on your stomach and one hand on your chest. And it's so important when you take a deep breath, you should feel your stomach go in. And when you release, you should feel your stomach go out. And at the same time, you're going to feel your hand on your chest. You're going to feel your chest rise. And it goes down. Try to do that for about 3 minutes. Don't try to do it too long because you may just pass out. But what I really want you guys to do is start practicing doing deep breaths exercises. It really helps you calm down and help you realize what's going on and try to get a better handle on it. So try some of those exercises and just see if deep breathing would help you be able to handle your mental health issues, or I'm not want to say issues, I want to say your mental health crisis. So You have to recognize the signs that mental health is affecting your daily functioning. When I say daily functioning, I mean things like chronic fatigue, lack of focus, emotional exhaustion, or even withdrawal from people who you're used to being around or activities that you're used to doing. This is the first step towards support and recovery. Now we're going to move on to the second topic that we are talking about today, and it's mental health. It's not just important, it is it has a lot to do with your physical health. So when we're talking about physical health, it is deep connection and equally important to your overall well-being. For many years, society has placed a strong emphasis on physical health. They encourage you to exercise. They encourage you to eat healthy. They encourage you to have even routine medical checkups while often overlooking the mental and the emotional wellness that you're going through. However, researchers and our daily live experiences continue to show that the mind and the body cannot be separated at all. We have to keep the two together because having both of them together helps us to maintain our balance. When mental health is neglected, it can directly impact the body by chronic stress, anxiety, and depression can lead to a physical symptom such as headaches, fatigue, digestive issues, high blood pressure, and weakened immune system. And we all knows what happened when your immune system is weakened. We are susceptible to a lot of colds, infections, things going on with our stomach. So we need to tap into those things because it's not only that those things are happening, we could be in the middle of a crisis as well. Over time, these effects can increase the risk of serious health conditions. That's why it is so important that we think about our heart, we think about chronic illnesses, and in the hospital, they always have a mental health provider come talk with someone if they're having any chronic illnesses. It's very important that you have that support when you're in the hospital so that you can, get well quicker because what they say is the mind is a terrible thing to lose. So, the mind, the body, and the soul, it all goes together. Taking care of your mental health involves many of the same principles as physical health: consistency, awareness, and prevention. Just as we go to the doctors for checkup, mental health should be monitored through self reflection. You can do affirmations, through conversations, talking to someone who you depend on or someone who you can trust. And when needed, seek professional support. Professional support can be a social worker, it could be your primary care doctor, it could be a psychologist or a psychiatrist. As we know, a psychologist and a psychiatrist are two different um, mental health professionals. Psychologist is the person who talks with you and find out if during the sessions they can help you become stable. A psychiatrist does both. They talk to you and they also can prescribe medication for you. Your primary care doctor, they can prescribe for you as well and talk to you about some of your concerns. But basically, as we know, there are different physicians for different reasons. You would not see a heart doctor if you wouldn't see an eye doctor for your eyes if you were having problems with your heart. So that's the same way that you should treat your mental health. You should either see your primary care doctor is your first choice to get all of that set up for you. Then you could also, if you don't want to talk to a psychologist, they have social workers who does similar to the same work that the psychologists do, but some people are more comfortable talking to a social worker than a psychologist. And the psychologist or your primary care doctor and the social worker can also give you a referral to speak with the psychologist if you and he or she agrees. Now, what I want you to know about is it is so important to make sure that you connect with healthcare professionals because they prioritize the patient care over their own well being. Sometimes people ignore signs of emotional and mental strain. Over time, if this is an imbalance, it can lead to burnout, decreased job satisfaction, and even physical and mental health issues. Promoting mental health is equally as important as it is to shift the conversation. It encourages individuals to seek help without hesitation. Prior to rest, make sure that you get your proper amount of rest. It's kind of hard these days to try to get 12 hours of sleep, but I will encourage you guys to always try to get at least 8 hours of sleep per night. That is not only for your mental health, it is just so that your body can rejuvenate overnight. The other thing is recognizing your emotions. Paying attention to your emotions is not an option, it is essential. It is essential to you so that you will know how to take care of your mental health. And as I told you, mental health goes a long way. When you begin to treat your mental health with the same urgency and respect as your physical health, we create a healthier individual, stronger families, and more resilient communities. And that's what we're striving for. We're striving to have more resilient communities of people being able to identify when they're having a mental health crisis so that they could get some assistance. The next topic is very, 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 very sentimental to me because for mental health to not be cared for as it was 20 years ago, it is more and more and more important now that we pay attention not only to ourselves, but to the folks that are around us. And if those folks that are around us need some assistance, let's do our due diligence to make sure that they get the assistance that they need. Stigma. Stigma prevents people from seeking help. And the reason why I say that is because in some communities, they always say what happens in our family or in our house, stay in our house. It's okay to keep what happens in your house and in your family in your house, but it's not okay not to have a good number for your mental health. Having an excellent number or having an excellent relationship with knowing when you're in a mental health crisis is so important. And it's more important nowadays because some folks and some occupations don't really understand when someone is having a mental health crisis versus just something actually going on with them. So, for that reason, this is why stigma is such a big quotation around that. Stigma is one of the biggest barriers to mental health care. It refers to the negative attitudes, beliefs, and stereotypes that society placed on individuals experiencing mental health challenges. These perceptions can be deeply rooted into cultures, upbringing, misinformation, and just not finding the right provider to give you the information and the care that you need. But I am here to tell you that if you're looking for um, a provider that understands your culture, your upbringing, then that's what you need to seek. You need to seek a provider that can understand your culture, your upbringing, your beliefs, so that you could get the help that you're needed. Stigma often shows up in a subtle and direct way. It can be comments like, just be strong. How can you tell somebody that's going through a crisis to just be strong? You'll just get over it. I'll just get over what? You don't even understand what's going on with me. So how do you know whether I'm just going to get over it? Or people say people have it worse than you have it. How do you know my crisis is worse than somebody else's crisis if you first don't even know what my crisis is? So I think that people should reevaluate how they answer, folks when they're giving them advice. It can also appear as judgmental, avoidance, labeling an individual as weak or incapable. You know, Sometimes we have to not be so quick to judge folks. And sometimes we just have to sit quietly and not give any of our advice. Not everybody is seeking advice. But, sometimes we just sit there and be quiet and just listen. And while you're listening, then you repeat what they say just to be sure you understand. And then that way that person feel a lot more comfortable with talking with you. That's why they say just listening is a hard thing to do for some folks. Sometimes you just need to listen. And when you respond, repeat what the person say so that the person knows that you're listening to them and not at them, if that makes sense. There are two major types of stigma: there's public stigma and there's self stigma. Who would have thought? You know, we just all go around talking about stigma, 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 but who would have thought that it was two types of stigma? Stigma, public stigma, and self stigma. Public stigma involves how others view and treat an individual with mental health conditions. Self stigma occurs when the individual individualize those negative beliefs and begin to feel shame, guilt, and unworthy. And that is not the way that we want people to feel. We want folks to feel comfortable, able to express their true feelings, and able to get assistance as well. Because of stigma, many people delay or completely avoid seeking help. But I'm hoping today on the Blue Scrub Club show that this is helping you become more comfortable with going out to seek assistance. Many people, as I say, delay or completely avoid help. They may fear being judged by family, co-workers, or even their community. In professional environments, especially healthcare individuals may worry about that speaking up and about mental health could affect their reputation or their career opportunities. You know, this word stigma and mental health plays a large role. And a lot of folks know that in their profession, it plays a big role in their profession as well, because they don't want anyone to think that they're crazy or that they're unstable or that they can't get through their job without having something go wrong. So, what I am here to tell you is the silence can have a much serious consequence. Without support, mental health conditions can worsen over time, leading to a decrease of quality of life, strains on relationships, and even more serious cases, crisis situations that can evolve into something much bigger or something more concerning. So it's very important that we don't let that word stigma interfere with our mental health. Breaking stigma starts with education, opening communications, opening conversations, your family, your friends, neighbors, just merely having the conversation with people that you can trust. When people understand that mental health conditions are a medical condition and not a personal failure, it becomes more easier to show empathy and support. Now, I'm going to repeat that. When people understand that mental health conditions are medical conditions, not personal failures, it can be easier to show empathy and support. Sharing stories, normalizing theory, and encouraging honest dialogue are a powerful tool in reducing stigma. That's something that we have to work on. That's something that we can work on. And that's something that we can help reduce stigma in our communities. Creating a safe space where individuals feel heard, respected, supported is essential. This includes workplace, schools, communities, and in your home. The goal is to shift the narrative from judgment to understanding so that people seek help and seeing a sign of strength and not weakness. Now we're coming down to the home stretch. We're talking about healthcare workers are at higher risk due to stress and burnout at their jobs. Healthcare workers are among the most dedicated and resilient professionals, but they're also at a significant high risk of mental health challenges due to the nature of their work. The demands of healthcare environments, longer hours, high patient loads, emotional intensity, and life or death situations create a level of stress that can be a difficult and strain over a long period of time. Burnout is one of the most common issues faced by healthcare professionals. It is characterized by emotional exhaustion, depersonalization, and a reduced sense of personal accomplishment. This means that individuals may begin to feel drained, disconnected from work, and less effective in their roles. In addition to burnout, healthcare workers may experience anxiety, depression, and compassion fatigue. Compassion fatigue occurs when continuous exposures to patients' suffering leads to emotional numbness and decrease in ability of empathizing. This can be particular challenges in nursing and caregivers who are deeply involved in patient care. The culture within healthcare can also contribute to these challenges as well. There is often an unspoken expectation to remain strong, push through the exhaustion, and have prioritized patients above all else. Leave what happened at home, come to work and put yourself and your work uniform on and pay attention at work. Sometimes it depends on what you're going through that you have to really make sure that you're taking care of self. While dictation is important, neglecting your own personal well-being can have serious consequences as well. Some other things that involved in burnout at work and healthcare is being at risk is staff shortages, workplace violence, administrative pressures. Lack of support system further increases your stress level. Many healthcare workers also carry emotional experiences from home, making it difficult to fully rest and recover and come back and work the next day. So, what I have to say is, most organizations play a key role in promoting wellness programs for employees, providing access to counseling services, encourage open conversations about mental health, offering individuals private conversations that they can have at work with other healthcare providers that can help them. And this is essential. Another thing, setting boundaries, seeking support. Practicing self care, again, is essential. This is an essential thing for healthcare workers. Addressing your mental health in healthcare is not just about supporting workers, it is about ensuring the safety and effective patient care. When healthcare workers are supported, the entire system becomes stronger and more compassionate. I have a question for the audience. What does your mental health mean to you in your daily life? I want you to sit upon that. I want you to answer that question. What does mental health mean to you in your daily life? Now we're coming down to the end of our segment, and what we're going to talk about real briefly. I'm going to try not to spend too much time here, but I will be spending some time here talking about the stages of grief. Let's start off by defining grief. Grief is a natural emotional response to a loss, not just a death, but also a loss of a relationship, health, identity, and stability. Those are things that we have to be concerned about as well. We have to think about the five stages of grief. Number one is denial. This isn't happening. That's the question that we have. Anger. Why is it happening to me? Then we're thinking about bargaining. If only I had done something differently. Depression, deep sadness, and withdrawn. Acceptance is acknowledging reality and begin to move forward. You notice I did not say heal. I said acceptance is acknowledging reality and begin to move forward. That's what I want people to start saying to people. This is the time that you are beginning to move forward. Not this is the time that you're healing, because when there comes grief, I don't believe anybody really physically healed totally. And as we said, that grief is not just a death. Grief is also the loss of a relationship, the loss of your health, the loss of identity and stability. All of those are a part of grief. So, denial. Denial is often the first response to loss. It is a natural defense mechanism that helps protect the person from being overwhelmed by the full impact of what has happened. In this stage, individuals may struggle to accept the reality of a situation. They may feel numb, shocked, disconnected, as if their experience is not real. Denial does not mean that a person is refusing the truth intentionally. Instead, it is a mind's way of slowing down things and allowing time to process difficult emotionals, difficult emotionals, difficult emotions gradually. When a loss first occurs, whether it is a death of a loved one, end of a relationship, or major life changes, the emotion weight can be too heavy to carry all at once. So denial creates a temporary barrier. People in this stage may say things like, "This can't be happening," or "There must be a mistake." They may continue with daily routines as if it hasn't changed, or avoid conversations about the loss altogether. Some individuals may even feel emotionally numb, unable to cry and express how they feel. Physical denial can show up as fatigue, confusion, or sense of disorientation. It may be difficult to concentrate or make decisions. The mind is trying to protect itself while slowly adjusting to the new reality. It is important to understand that denial is not a negative stage, it serves as a purpose and grieving process. However, staying in denial for an extended period of time can delay the healing. So, support from others can help the individual gently begin to acknowledge the reality of their loss. As this time passes, the protective layer of denial begins to fade, allowing other emotions to surface. This transition necessary for healing, even though it can be uncomfortable. This is one of the tough parts, is the anger. Why is this happening to me? Anger is powerful and often misunderstood stage of grief. After the initial shock begins to wear off, the pain of a loss becomes more real, and the pain can turn into frustration and anger. This anger may be directed at a different source, including oneself, others, healthcare providers, circumstances, or even a higher power. People in this stage may ask questions like, why me? Why did I deserve this? Anger can also be expressed as irritability, insensitive, or impatience. Small things may trigger strong emotional reactions. Individuals may feel overwhelmed by emotions they do not fully understand. Anger is a natural response to feeling powerless. Loss often removes the sense of control and anger and can create a temporary sense of strength or release. It is an emotion that demands to be felt and acknowledged. In some cases, individuals may feel guilty for being angry, especially if the anger is directed towards someone they lost or a loved one. It is important to reassure them that the anger is normal part of grief and does not reflect the lack of love or respect for that person. It is not expressed in a healthy way. Anger can lead to conflict, isolation, and emotional distress. Healthy outlets such as talking, journaling, physical activity, or counseling can help to process these feelings safely and may help a person move along a little better. Understanding that anger is a part of the healing process that helps reduce the shame and allow the individual to move through it rather than suppress it. We still have we're going to get to the depression, deep sadness, and withdrawal. Depression is the grieving process, is not just sadness. It is a deep, overwhelming sense of loss. At this stage, the reality of the situation fully sets in, and the individual may begin to feel emotional weight of their grief. The stages can include feeling emptiness, hopelessness, and loneliness. People may withdraw from social activities, lost an interest in things they once enjoyed, experiences changes in their sleeping pattern and their appetite. It may feel difficult to find motivation or purpose. Unlike clinical depression, this stage is a natural response to a loss. However, it can look very similar and should be monitored closely. If symptoms become severe or prolonged, pro- professional support may be necessary. Individuals may feel like they're stuck in their grief, unable to move forward. It's important to understand that this stage is a part of the process, the loss, and not the signs of failure. Supporting during this time is critical and encouraging connections even in a small way. can make a difference. Simply acts like checking in, listening, being present can be comfort. Allowing oneself to feel the sadness rather than avoiding it is an important part of healing. Over time, these feelings begin to soften, making space for acceptance and adjustment. Now, let's talk about acceptance. Acceptance is the last process, acknowledging reality and beginning to move forward. Remember, beginning to move forward. Acceptance does not mean forgetting or being okay with a loss. Instead, it means acknowledging the reality of a situation and beginning to adjust to life moving forward. In this stage, individuals start to find a new sense of normal. The pain of the loss may still be present, but it becomes more manageable. And that's where we want to be, in a managed state. There's a greater ability to function, make plans, and re engage with life. Acceptance involves understanding that the loss cannot be changed, but life can continue in a meaningful way. People may begin to create new routines, set new goals, and find ways to honor what was lost. Emotionally, this is often a sense of calm compared to the earlier stages. While moments of sadness may still occur, they are less overwhelmed. Individuals may begin to reflect on positive memories and experiences. It is important to emphasize that acceptance look like. It may be different for everyone. There is no time limit for reaching this stage, and people may revisit earlier stages even after reaching acceptance. This stage represents resilience and growth. It shows that healing is possible even after a deep loss. This is an important note. Grief is not a linear. People may move back and forwards between stages. Now, I have a question for the audience. Have you ever experienced grief in a way you didn't recognize at first? Hmm. Answer that question. Write that question down. I'm going to repeat it again. Have you ever experienced grief in a way that you didn't recognize it at first? This is my last segment here. I'm just going to touch on this a little bit. I may not get through all of it, but I do really want to touch on some of the coping and healing mechanisms that you can do. And I want you to do some research as well. Now, practice some of these strategies. And if I don't get through these strategies today, be sure and follow up and research. Talking to a trusted person, professional counseling or therapy, journaling through your emotions, practice self care and rest, engaging in faith or spiritual practice, and joining a support group. They really help. Talking to a trusted person. Let's talk about that definition. Talking to a trusted person means sharing your thoughts, your feelings, your experience with someone who provides a safe, non judgmental space. This could be a friend, a family member, a mentor, a colleague who would listen with empathy and support. That is very, very important. A nurse experienced burnout. This is just an example. A nurse experienced burnout after a long shift may call a close friend and openly express her feelings of exhaustion and mentally strain. Instead of holding everything inside, they release those emotions through a conversation. Even hearing, I understand, or you're not alone can provide relief and validation to that person. That's why it's so important to make sure you choose your words right. If you're not choosing your words right, then just merely just say I understand, or you're not alone if you've experienced that. That gives them some relief or some validation. Getting professional counseling and or therapy. Professional counseling or therapy involves working with a licensed mental health professional who is trained to help individuals understand the process and manage their emotions, behavior, and life challenges. That's what I like about that. And why it matters, because therapist provides the tools, the structure, the unbiased support that friends, family, and other people may not be equipped to offer. It provides a proactive step towards healing and emotional stability, and that's why professionals are an excellent choice. Now we're going to talk about journaling thoughts and emotions. Journaling is the practice of writing down thoughts, feelings, and experiences to process emotions and gain clarity. It allows the individual to express themselves without freely, without fear of judgment or anyone answering that. Why does that matter? Journaling matters because it helps to release bottled up emotions, reduces stress, and increase self awareness. It also serves as a record of growth and healing over time. Practicing self care and rest. Self care involves intentionally taking time to care for your physical, emotional, and mental well being. Rest is a critical part of self care and includes both physical sleep and mental breaks. Why is it important? It is important. Without self care, individuals can experience burnout, fatigue, emotional exhaustion. Rest, restore energy, and improve focus, and most of all, support your overall health. Engaging in faith and spiritual practice. Faith and spiritual practice involves connecting to a higher power or personal belief system and guidance, comfort, and strength. This can include prayer, meditation, attending service, or reading spiritual texts. Why does it matter? Spiritual practices can provide hope, meaning, and a sense of purpose during the difficult times. They offer emotional grounding and inner peace. Joining a support group. A support group are gatherings of individuals who share similar experiences, such as grief, depression, or caregiving. These groups provide a space to share, listen, and learn from others who really understand. And why does this matter? Support groups reduces the feeling of isolation and remind the individual that they are not alone. It also provides a community of encouragement and sharing understanding. Closing this message and this segment, these strategies are not one size fit all, but they are starting points. Healing begins when you take one step, reach out, and give yourself permission to be supported. Here's another key message: healing takes time, and seek help is a part of strength, not a weakness. Where you can find help. The national resource, they have a line that you can call, is 988. That's the suicide and crisis line. You call, or you could even text if you don't feel comfortable with calling. It's 24 hours a day, 7 days a week. It's free and confidential. National Alliance on Mental Health, NAMNE, offers education, support groups, and resources. Also, I have some other information, which is substance abuse, mental health services, and administration. Treatment, find local mental health services, additional support, local community clinics, EAP, which is at your job, which is employee assistance programs. You have faith based counseling, school or workplace mental health services. Those are all wonderful, wonderful support system. Thank you for joining us tonight on the Blue Scrub Club. Let this be your reminder: you're not alone, your feelings are valid, and help is available. As a healthcare professional and community member, Let's commit to checking on one another and also checking within ourselves. That is so important, to be sure that you are checking your friends, to be sure that your friends are okay. Until next time, take care of your mind, body, and your spirit. Good night from the Blue Scrub Club Show. Thanks and see you next week.
Trivia's Inspirational Radio would like to inform you that the views, thoughts, and opinions expressed in the following show are solely the sentiments of the participants of the show. Trivia's Inspirational Radio Network is not responsible for content. As always, thanks for watching and enjoy the show.